Today we're speaking with Nekita Singh. She is a social worker at the ER in Mount Sinai. We're going to hear a little bit about her experience as a social worker there and also how that whole experience has shifted now with the pandemic. So
Mhm,
right over to her. And Nikita, why don't you start by telling us a little bit about your role, what that
mhm.
looks like on a day-to-day basis, pre-pandemic, just give us a little description of what your job looks like.
Yeah, sure. So, before the pandemic, Mount Sinai has started a program. So we have 24/7 social work now, which is really
Mhm.
great. So what that means is like the staff in the ER, we cover when the inpatient social workers are gone from 9 to 5, we cover their areas,
Mhm.
including our own areas in the ER. So that could be from, most of our work is crisis intervention in the ER, but then we also can see an influx of like domestic violence cases, sexual assault, child abuse cases, fetal demise, deaths, pretty much everything where we offer support to families and kind of we have to get involved in that.
Mhm.
We usually call those cases like their protocol cases.
Okay.
And then even from simple things as like transportation, home care, helping people get to rehabs. So we do a lot of that as well. So discharge planning.
Wow, that's really amazing to hear. I don't think that on a day-to-day basis you really think about the people who handle those
Mm-hmm.
tasks in the ER. And now, speaking on what you normally used to handle, how has that
Mm-hmm.
shifted since the
So
pandemic?
yeah, so it's definitely shifted. Before this, I had a lot. I would see a lot more, women come in for domestic violence or like sexual assaults, and haven't had that in the past. Maybe 3 weeks since this has all started. So even things with elderly patients coming in for abuse or like issues with their home attendants, just you know social problems, things like
Mhm.
that, I haven't been able to see a lot of. Right now my role has really changed in the sense that we're doing a lot more palliative care. It's more focused on. So when patients come into the ER, some of them are already so sick that they have to be intubated here, or we're able to get them stabilized enough. So what that means is like for social work, we start that conversation very early on, because
Mhm.
what we've seen in the past 3 weeks is that if someone is stabilized in their ER and they're waiting for a bed on the
Mhm.
inpatient floors, they can quickly desaturate, and then it becomes a problem because we don't know who the next of kin is, their emergency contact, their healthcare proxy, what were their dying, what were their
Right.
wishes, being able to respect that. So right now what we're doing is we've now had our ER team has deployed um, residents from other areas, so like
Mhm.
oncology areas, that psychiatry, and they formed a palliative care team together. And so they're really working with us to, so they're in the areas that we can't go in the ER,
Okay.
and they're really working with us to um, do the assessments with these patients that are stable enough to do them with, so that
Mhm.
we can know like what do they value in life,
Right.
what
Right.
do they have in healthcare proxy, because
Mhm.
oftentimes when they come in you don't get to do those things right away, and now it's very important because if God forbid something were to happen, we have that on file, and we have a contact. So it's more palliative care driven now, and that doesn't always necessarily mean death and dying. It's, I like to think of palliative care as more of like comfort measures and what people
Right.
would really want, so, and respecting that.
Mhm. And so
Yeah.
I know also just from seeing, previous conversations that we've had and things that you
Yeah.
discussed with your experiences, and why don't you touch a little bit on how this has really been affecting the homeless population and the challenges you've seen there with this type of care?
Yeah, so definitely the homeless population. Even now, when I take the trains to work every morning, I see like 6 or 7 of them in one cart,
Mhm.
and it's really like I feel like it's not. I don't know. It's not being addressed. I haven't seen it much in the media.
Mhm.
Um, you know,
You're right. I
I've
don't think that
had,
I have seen
yeah,
that at all being
yeah,
spoken.
like it's right now, like I've had patients who've come in that are homeless, whether street homeless or they are in a transitional shelter, and they have tested positive for
Mhm.
COVID-19. And then it becomes an issue because they can't go back to their shelter, or if they're street homeless, they have nowhere to go. And so it's such a long process because DHS, which is, Department of Homeless, we have to reach out to them, and then they have to find them like a hotel where the patient can isolate,
Wow.
and that can take hours. you know, and sometimes we don't have hours because like we need beds, you know,
Right.
it can get very intense. I mean, and the other day I had a patient who actually came in from a shelter, and he was, I don't know, maybe like 60, and he passed away. And, you know, the team was, you know, asking social work to try to help with finding if he had a friend or family member, you know, a next of kin on file, because there was literally nothing on his chart. The ambulance just brought him in. We didn't know from what shelter. It wasn't up until yesterday, so that was like, what, 48 hours later after he died, that I finally was able to get in touch with the shelter to find out that he did have an emergency contact, and it was a friend. It might have not been family, but that might be his only, you know, person that, you know, everyone deserves, if, you know, I don't know how to put it, but like, if there is somebody out there that really cares for somebody, they deserve to know. And no one should be able to like die in a way that, you know, regardless if they're homeless, putting them in Potter's Field, like that's, you know, just not like they deserve to have someone there and to know that cared for them regardless of their circumstances. And, you know, everyone's life is valued, and I believe, you know, we should really think about those things. Yeah. I don't know if that made sense. I'm on ramble.
No, that made complete sense. I think that really also touched on the amazing part of being a social worker, and why people even choose to go into that field is that belief that there is, everyone deserves a level of care, whether that's from your community, from your family, from our government, our healthcare system. And it's really amazing to know that there are people like you advocating for even unseen population, because I completely agree with you. No one deserves to be alone in any moments, but especially
we have a lot of mental health resources. There's mental health professionals that are working around the clock, so you can reach out to somebody. Even staff here, we're offering support. So we're not only holding space for patients and families, but we're also holding space for staff members. Like we recently started, so that right now at Mount Sinai, which is great, they started like a mental health liaison. So it's literally consists of like literally everybody in the mental health field: psychiatrists, mental health counselors, psychologists, like social workers. And we're like a big team. And we, like in the ER, we offer this thing called chai time. And so it's like, it's an informal way of letting, you know, staff know that we're there for them. And so if they feel that it's, you know, and we offer tea and like essential oils and all those things. And it's very informal, but it's like, we also have a chaplain on an iPad now. Normally she would be there in person, but because of COVID, we can't have that. But it's an informal way of letting staff and families know that we're there for them, and that if they needed somebody to reach out to, we would be there. Yeah, because I'm sure after all of this, there's going to be an influx of like PTSD.
Of course.
For sure.
That's a very big worry, and I hope that as a city we're prepared to take on those numbers and what that look like.
Yeah.
Because there's no way to walk out of this without a little bit of trauma. But it's really good to know that you guys are putting steps in place to help ease into that, and hopefully not have to make the process as hard as it would be. There was some changes being made, obviously, to Mount Sinai, and you can talk about that as well. How the dynamic of the hospital has changed to really, you know, help with the influx of COVID patients, and then what has been changing in your department technology-wise that looks a little bit different now?
Yeah, sure. So right now, our department is offering a lot of the social workers, if you want to work from home, if it's something that, you know, they've been working through this, you know, a lot of people work off-site, or you have the opportunity to work on-site, or you can do like a mix of both. Like sometimes you're here, sometimes you're not, splitting your schedule. So that's really helpful. They, you know, right now in our ER, it's usually how it works is when you come in, you're triaged, there's intake, and then we have acute areas 1 and 2, and then acute 1 is combined with our resuscitation unit area. So right now, the only area that's not COVID, is intake. So pretty much everything is locked off. There are no visitors allowed. You cannot enter any of the acute areas without full PPP on. So that's protective equipment. for medical staff. So for social work, we've resorted to using flip phones. I know they've come back.
Mm-hmm.
We have, we
Not
have
the comeback we
robots.
needed this year, but I guess.
We have robots now that we can control from our offices. We have iPads on sticks, on wheels, whatever you want to call it. And what happens is, and we also have this thing now where with our medical system called Epic, you can chat a provider. It's HIPAA friendly. No one has to worry. And we usually tell the provider that if the patient wants to see us, or if they know the patient wants to see us, they have to come pick up the phone or the iPad, give it to the patient. The patient talks to us via iPad or phone, and then they have to use like wipes, wipe it all down, and then give it back to us, because we're not allowed. We can't go in unless it's like, unless we've exhausted every single option, then we'll have to go into that area. But so they've done a lot to make us feel safe, for sure. Yeah.
It's a very good use of technology, and I'm very glad that they're working as hard as they can to protect you guys from exposure when it's not needed. And really, just lastly, we want to touch on anything lastly that you'd want people to know about your role. What would you want to leave people understanding about this pandemic, and why we need to take the measures that our government, our states, and our governors themselves are putting into place, and just advocate on behalf of yourself? Is there any last you want to get in?
We definitely, when they say to stay home and it saves lives, it really does. You're protecting people who are immunocompromised. If you don't really need to go outside, don't go outside, unless it's like for groceries. When they say social distance, it's helpful. Like on Monday, I've seen death back to back. And that's something I've never experienced in my, 2 to 3 years as a medical social worker. I've never seen that many codes, and having to call families and finding out the next of kin and all of that. It's hard, and it's what you're seeing is on the news can be, some people can say that it's being dramatized or whatever, but it's, what the government is telling you to stay home, you need to stay home because it's really serious. Another thing that's like infuriating for me is like when I walk home and I see masks and like gloves on the sidewalk. I feel like there needs to be some sort of psychoeducation about that, because it's, part of the that's also part of the problem. It's like, you want to take precaution to go outside, but don't throw your things on the floor. Like that's cross contamination right there. So that's something else, and I think just, I've even heard like on the news recently about things in our neighborhood, like a bar being closed, but then they were letting people in through the back entrance. Thankfully it was closed down, but like don't gather. Like that's how you get sick. Like this is something that our medical professionals are fighting that we can't see, and it's very real. Like we're seeing it right. It's, no one wants to be in the emergency room. No one should have to be in a hospital. Like it's not a place you want to be.
No, we definitely agree, and we hope that our community really takes these words from you seriously, this firsthand. I know a lot of people need to see things for themselves to be empathetic and to really take heed, but these videos is for people that not end up in the ER to take things seriously, but to really get that perspective from people like you. So we really appreciate you sitting here and today about all of this. We will pray for your continued health and your protection for you and your family, and hope to see you on the other side. And
thank you for doing this. I really appreciate it. I really support what you're doing, and I think our community needs it. So, yeah.